Good evening, everyone. My name is Anika Baty-Mills, and I would like to welcome you to COVID, a community conversation, presented by the Columbia Association in partnership with the Howard County Health Department. And it is my pleasure to be your moderator this evening. Again, my name is Anika, and I am the publisher of Columbia Inspired Magazine. Columbia Inspired Magazine is a community publication that is online and focused on creating and growing community connections in Howard County for its residents. We specialize in sharing the good news and helping our residents feel seen, heard, and cared for, which is why I'm extremely excited to be a part of tonight's conversation. So thank you to the Columbia Association for allowing me to be the moderator. It can be tough to make sense of the recent and what seems to be always changing health information in reference to the developments of the pandemic. Anxiety, stress, and uncertainty has unfortunately been a part of our lives for the last 17 to 18 months now. So one of the best things that we can do to arm ourselves and alleviate some of that is just simply be informed. So I want to thank you all for joining us tonight for this important conversation. I want to do a little bit of housekeeping before we get started and introduce our panelists today. First, the discussion is being recorded, so this will allow for those who aren't able to attend tonight to have access to this information so they can watch at a later time. The Columbia Association will be posting this recording on its YouTube page, and we're also streaming live on Facebook. Second, in this webinar format, we are asking that you use the question and answer function to submit your questions. The chat has been turned off to streamline the process, so you can access the question and answer function by clicking the Q&A option at the bottom of your screen. Type your question into that window and then indicate whether or not you would like to remain anonymous by checking the box labeled Send Anonymously. Otherwise, we will only use first names, but we wanted to be sure to give you options because we understand that some of these questions will be sensitive. We will do our best to answer as many questions as possible with the understanding that we have one whole hour. I want to begin by introducing our panelists for this evening and thank them for being here. I'd like to start with Dr. Mara Rossman. Dr. Rossman is the health officer for the Howard County Health Department. She has almost 25 years of experience in public health. She was appointed health officer in 2012 and has worked for the Howard County Health Department since 2007, serving as medical director and deputy health officer of clinical services. Prior to coming to Howard County Health Department, she served as the medical director of school health for 10 years in the Baltimore City Health Department. The first 10 years of her medical career was spent in academic pediatrics and as a Scrabble word here, guys, a neurodevelopmental specialist. So thank you so much for coming, Dr. Maura. We really are looking forward to being able to answer some wonderful questions this evening. I would also then like to introduce Dr. Harry Oken. Dr. Oken, am I pronouncing that last name correctly?
You are, yes.
Wanted to make sure. My first name's Anika, so I understand how that can go sometimes. Dr. Oken has been practicing internal medicine in Howard County for 34 years and has been an active faculty member at the University of Maryland, now an adjunct professor of medicine. He was the chairman of medicine at Howard County General Hospital for 14 years and has been the medical director of the Columbia Association since 2007. He recently co-authored the book, Boom, Boost Your Own Metabolism, a guide to a better life. Throughout the pandemic, he has been sending COVID updates via email to his patients. To his astonishment, they have been forwarding and re-forwarding countless times, literally around the globe. We truly appreciate you both for taking the time out of your day to talk to the community, and we're not going to waste a whole lot of time. We're going to jump right into it. I would like to start with both of you just giving you a chance to give us some reflections, what it's been like serving throughout the pandemic, serving the community, especially in these last few months and weeks as we become more familiar with the Delta variant. As a Howard County resident myself, I know, and a Howard County school parent, it has been a lot of information coming to us and trying to make sure that we are taking care of the families in our homes and ourselves. So I really would love to hear how you all handle it currently, especially being that you're not only doctors, you're also people. So Dr. Rossman, I'd love to start with you to just hear how you have been able to work with the community, but also be able to take care of yourself during this time.
Well, first I want to say, Anika, thank you for having me, and thank you for the opportunity to presenting with Dr. Oken and talking with the community, because we're all in this together, as you're sort of alluding to. And what an important question. No one's asked me that. How are you doing? And I'll be the first one to admit, I don't self-reflect. As a physician, I'm not really good at taking care of myself. And many healthcare professionals, I'm not alone. So why I'm willing to say that, to this group. But incredibly important to be able to reflect upon. I counted up while I was waiting here, for public health, this is day 575 that we have been responding to this pandemic. And to the great tribute of public health, what we've done and accomplished in the past year and a half is amazing, but we're not used to that. To the credit of the past 18 months, now everyone knows sort of what public health is, or what at least a small part of what we do, but it's been a long haul. And I will admit, as a health professional and a public health professional, I get tired. But I'm amazed by the resilience of our community, the resilience of our healthcare community, and science. I've spent a lot of years in school getting to the point of being a physician and a specialist and a public health professional. And one of the things that I've relied on for the past 18 months is science. This is a novel disease. We didn't know much about it, if anything, 18 months ago, and every day we're learning more. And as a scientist, I appreciate sort of the roller coaster that we've been on, but as a public health official, I also realize the challenge with communicating the roller coaster with the public and the different information that we're getting. Even today, right? Hearing, last week, additional doses are now available for persons with certain immunocompromised conditions. But then on the news you turn on in the morning, in maybe a month, all adults can get boosters. So it's been a challenge, for everyone, including myself. And I have to say that I rely on my family, like everyone else, to pick me up when I'm down. And my colleagues certainly, and the amazing work that your Howard County Health Department workers have done for 575 days. And if it's another 575 days, they are in it to the end. So we're resilient. And so I guess if you ask me one word to describe how I feel today, resilient.
It's a good word, and it's something that we've all, if we weren't before, we definitely are learning more how to be better at being resilient. Thank you for that, Dr. Rossman. Dr. Oken, I'll also ask you, it's also in reference to how you're interacting with your patients, what you're feeling when you are working with us when we come into your office, as well as how you are handling it personally.
Thanks for asking, Anika. And as I look at you and I look at your background, that you're on beautiful Wild Lake, and it makes me feel so good about Columbia and Howard County. And kudos go to Dr. Rossman and her staff, because Howard County has distinguished itself in this state. We have done such a tremendous job. The other day, I think I was looking through some numbers, and I think we have greater than 85% of our community having at least one vaccination. That is wonderful. There's only, I believe, about 30 or 40,000 people in the county that have not been vaccinated. Now, we can do some work there to keep helping them, because as Dr. Rossman says, the science is so important here. But beyond the science has been an emotional roller coaster for so many people. When is this going to be over? What are we facing next? We got through 3 surges. We're now in the 4th surge. What's happening after the 4th surge? But throughout it all, I've always tried to keep very optimistic. And that's one of the things that I have regularly put out to my patients about being optimistic and making the most of some of the incredible pressures that we've been under. I called it in one of my emails to my patients, pandemic compression, because we're all feeling it. And then pandemic fatigue, how this has impacted on us. And as we talk about that and think about what can we do for ourselves to keep it up, you know, what we're all succumbing to is, in some cases, is our immune system being invaded by this nasty virus. And so one of my key messages to people is keep your immune system healthy. And how do we do that? We do that by good nutrition, regular exercise, restorative sleep, and stress control. So this immune system, which is like a platform, it's held up by those 4 pillars, and we have to keep reminding ourselves of that. The other thing that I've done is a lot of contemplation. You know, throughout this in Howard County, almost all of us have had a roof over our heads. We've had our bellies full. We've had everything we need. We're so fortunate here in this county. And I keep on reminding myself of how fortunate we are, the resources we have, and the wonderful structure and framework that has made us successful. So thank you to the health department, and thank you to our leadership here in Howard County.
Yeah, I definitely have to agree. And I also think for those of us in the county that we don't often see sometimes that don't have everything, we have resources here for them as well. And we have a community that reaches out to try to help and spread the good information and give them support. So we definitely are in a good place. So thank you for those reflections. I think it's just important for people to remember that, you know, we're not all of our titles, and those things affect us as well. And I'm going to just jump right into some questions. But I wanted to first just have, if you could, Dr. Rossman, just give us a brief description of what really a variant is. I think that's important for people to understand as we springboard into some more deeper questions. So if you could explain the variant to the virus and then give us a little bit more information about the Delta variant itself.
Sure. So we're dealing with SARS-CoV, right? That was the official sort of scientific name that I think we all call COVID-19. And it's a virus. And viruses like to change over time or mutate. So that's a mutation or a variant. So over time, SARS-CoV has changed geographically in different parts of the world. And we live in a global society now, right? People get on airplanes and we bring the different mutations around the globe. So there are so the novel SARS-CoV started out, well, I don't know when, probably in 2019, right? But over time, different variants have evolved to make the virus more adaptable. Because that's what viruses like to do. And I'm sort of using a metaphor, right? It's not a human, but viruses need to infect people to stay alive. And as we've adapted with our non-pharmaceutical interventions, initially masking, social distancing, it had to work harder at trying to infect people. So at this point in time, you mentioned the Delta variant. The Delta variant has made this virus more adaptable in terms of it able to be more infectious. So, and it's a variant that came upon the scene post the development of vaccines. So when the vaccines were developed, they weren't able to test it against the Delta variant. But since that time, the vaccines that we have been analyzed to see how effective they are against the Delta variant. And the Delta variant, again, is more highly transmissible or contagious. So what that means is if 2 people are close together or closer together, it's easier for the other person to get it than, say, 18 months ago. And that's what we worry about, because now more people can get sick at a given time. And there's debate whether or not this variant or the Delta variant is also causing more severe disease. there's no doubt that it's infecting more children and younger population than the novel coronavirus 18 months ago. But in Howard County, 100% of 75 and up and almost 100% of 65 and up are vaccinated. So again, I'm using a metaphor. If this virus needs to find people, who's it going to find? Well, our kids, because our kids, our younger kids, are not yet able to be vaccinated. So I think that's why we're seeing younger kids and people being infected, because they haven't yet they're not unable to be vaccinated, or perhaps newly vaccinated.
Dr. Oaken,
So that's,
Dr.
and the
Rossman, I wanted
concern
to.
that you'll hear researchers talk about is the way to create a barrier or defend against these variants or mutations is to get more people vaccinated. So the stakes are higher, and I've heard people say the goalposts keep moving, right? Dr. Fauci said 6 months ago that we needed 70% of the population, now 80 or 90. Well, right, because mutations and the science keeps changing. So the best bet we can do is really get everyone vaccinated, because it creates this barrier or makes it really tougher for this virus to invade. Hence why you keep hearing, and as Dr. Oken mentioned, you know, we're like 87%. We're going to be by Labor Day 90%. Unheard of. That was an aspiration, but that's not good enough. We got to get 100% of people who are eligible to be vaccinated to protect those that are not able to be vaccinated, our children, our babies, and those with immune compromised conditions that even with the third dose, it may not be as effective. So, you know, this is loving each other, loving ourselves, and the best way to do that is vaccination at this point.
Thank you for that, Dr. Rossman. I want to take something that you said and ask Dr. Oaken, when we were talking about that transmission and how it's Delta variant is really easily more contagious than we had to deal with last year. And we're talking about cures versus vaccines. I think it's important. There are a lot of people, when we're talking about breakthrough cases and understanding what that means in reference to the vaccine versus it being a cure, and why we're able, for those of us that are vaccinated, to be able to still be carrying the virus.
So let me make some comments on further about, first of all, variants. The latest big surge that we all heard about was in India, where at one point there were 400,000 cases per day. Think about each individual person was having in their bodies at least 1 billion, sometimes 1 trillion replications of the virus. So if you think about 1 billion people, 1 billion replications in 400,000 people, there's a lot of chance we're going to make variants. So a variant happens in the replication of the virus, and when it replicates, it doesn't always replicate perfectly, and when it doesn't replicate perfectly, it's a little different from what it started. Now, the predominant amount of those variants that are a little different are duds. They go nowhere. They're not able to infect other cells. But every once in a while, a variant replicates and it's a little better. So it's survival of the fittest, and it's able to get into somebody else and do the same thing. And so that's how these variants actually arise. They arise because there's so much replication in each individual person. And when we're having a big surge, there's more chance of a new variant coming about. Now, the first infection is what we kind of call the wild type. That was the original COVID-19 virus. Now we're concerned about the Delta virus. And the Delta variant, and there's two ways to look at variants, and the WHO categorizes them as variants of interest and variants of concern. So the variant of concern right now is the Delta, and because the Delta is a little different, the way it can be transmitted, it seems to be much more contagious, but it's probably not more pathologic or pathogenic. It's about the same. And that's one of the wonderful things that we're seeing with our vaccine, that even though it may be more contagious, it's looking like our original vaccine made to the wild type is doing its job, markedly reducing hospitalizations, the risk of mechanical ventilation or respiratory failure, and death. So we're so fortunate that our original vaccine is holding.
So when we're talking about if we were to contract the COVID-19 virus, what we're saying, and I want to make sure I clarify, is that the vaccine that people have taken seems to still be working, even though we are dealing with a different part of the virus or a different virus, because in other words, it's still effective against that.
It's still very effective in decreasing our risk for hospitalization, for worsening respiratory problems and death.
Okay.
Very, very effective.
That's perfect. Okay, good. I just wanted us to kind of lay that groundwork. So when we're talking about, why do they call them breakthrough infections? Is it just because you've had the vaccine and you still have got COVID? Is that what that means?
Yes.
I want to make sure that we understand that. Okay.
So
well,
if you've been
I'm going
vaccinated, right?
Go ahead.
If you've been
No,
vaccinated and you get sick, okay, then that's a breakthrough. But some people who've been vaccinated, unknowingly to them, have asymptomatic infections, and then they may be spreading it. And so that's why it's so important that we urge people who have not been vaccinated to get vaccinated.
I got it.
Now, the population of people that are vulnerable right now is a much younger population. So if they do get it, they're more than likely to actually do okay. Nonetheless, they're still vectors to spread it to other people.
So we're going to actually travel down that vein. I have a question here that we have from Joseph. And the question is, how many seniors have gotten very sick from COVID after vaccination? And is this less effective against the Delta variant, which I think we've answered that. But do we have an idea about any of our seniors, if there's any statistics on them getting COVID-19 with the Delta variant?
So I don't have the exact numbers, Joseph. Thank you for that question. Again, we go back in time to the beginning of the pandemic, the awful toll on our seniors, particularly our seniors living in the skilled nursing facilities. That's where we saw the hospitalizations and fatalities. Awful. We are in a different place right now. We are seeing increases in hospitalization among all groups, so younger and older. But again, as Dr. Oken, I think wellly explained, is that the unvaccinated are at the greatest risk versus the vaccinated. So at this point, the proportion of those being hospitalized and dying are not, we are seeing younger, but and fewer than a long time ago. But if I probably analyze the data, which I don't have now, is that statistically we would see more persons over the age of 65 being hospitalized and dying because of comorbid conditions and other conditions why they are at greater risk for poor outcomes once they get COVID-19.
Okay. Thank you for that question. Thank you, Dr. Rossman, for that. We have it's the same question. Going back to, I believe Mary's asking a couple questions that probably are grouped together, I would say. So we'll do that. Dr. Oaken, we'll have you field this one. We're talking about children wearing masks in schools. Should we go back to social distancing? Are gyms safe? Should we be back to having to wear masks in those areas?
So that's a real tough one as far as I'm concerned, about whether children should be wearing masks in schools. When we look at the mortality rate in children in Maryland, it is extremely, extremely low. So we know that children actually fare very well with if they get COVID-19. So the question about whether or not masks are helpful and important and need to be mandated is very much, I think, in some ways a political question. One thing is clear to me in the school system, that the teachers should all be vaccinated, and the teachers probably should be wearing masks because they're more vulnerable because of their age. Now, as you know, the vaccine is approved for children over the age of 12. I'm hopeful very soon we'll get the FDA approval for 2 to 12, and that should make a big difference. Social distancing, obviously indoors is very important. It's really indoor air that is probably our biggest nemesis. If there's a super spreader in an indoor environment where the airflow is poor, it's much easier for the Delta virus to be passed.
Okay, so they were specifically asking about the gyms in the area. Is it the same concept when we're talking about the schools and the gyms having to wear a mask, be socially distanced? Is that going to be something that we maybe consider to happen in all areas?
So this is such a dynamic phenomena here of what we're dealing with. The answer is yes. We're considering it on a daily basis, whether or not we should mandate wearing masks in the gym and in other places. But it's so dynamic, and that's what happens in a surge. A surge happens, there's a dynamic change in behavior, and then you hope that the surge calms down. Presently in America right now, I think in the last couple of days, we're seeing a million new vaccinations a day, which is wonderful. And we're seeing people flex a little bit and staying out of crowded conditions and doing more things outside. People have asked, many times, why are we surging in the summer? And one of the real big answers is, in my opinion, is we're surging in the summer because it's hot and people are going indoors. And you're particularly seeing this in the southern states. It's hot down there, and people go into air conditioning. And in air conditioning, depending on the airflow, there's a much more likelihood that these small little viruses, 0.5 microns, float in the air, and one can easily become contaminated and infected.
I'm just going to put a plug in for, I think I mentioned it, non-pharmaceutical interventions. So before we had vaccine, we were relying on non-pharmaceutical interventions. Big word. But that was social distancing, wearing masks, washing our hands, all the things we learned in kindergarten, right? So for me, and I'm talking from prevention and public health, and also as a pediatrician, wearing a mask is the cheapest, most effective, easiest thing that any of us can do to protect ourselves from a variety of respiratory illnesses, including COVID-19. So I encourage, Howard County is now in the CDC range where we have increased transmission, where they are recommending that everyone, regardless of vaccination status, goes indoors in a public setting, wear a mask. And I extend that to children over the age of 2 as well. It's easy, it's effective, and most of the children don't have problems wearing masks. It's the adults who are concerned about the effects of wearing masks. And for 18 months, I think we've gotten used to that. And so if you're looking for a cheap, easy, really highly effective way of layering another a layer of protection around yourselves, masks are the way to do that.
Using all the tools that we have at our disposal, basically, to combat the virus as much as possible. I would like to, Dr. Rossman, I think I'm going to ask you to answer this question. This is by, I believe it's Rena. This question is the booster third dose the same composition as the first 2 doses, or were they tweaked genetically to specifically attack the Delta variant?
So currently, the recommendations for the additional doses are exactly the same as the composition of the first 2 doses. And it is recommended that you receive the 3rd dose be of the vaccine type of the first 2 doses if possible. So right now, the additional doses are only authorized for Moderna, for the mRNA vaccines, the Moderna and the Pfizer. So if you received Pfizer, the first 2 doses, you should get Pfizer the 3rd time. If you received Moderna the first time, you should receive Moderna the 3rd time. If you receive J&J 1 dose, well, the research is still out, and in the next few weeks, I'm sure they're going to tell us whether or not persons who have received the J&J single adenoviral vector vaccine should receive a booster as well.
So they're not sure yet about J&J. They're in the process of finding out more information. But what I think I heard you say, I want to make sure that I'm right. If you receive the Pfizer, you should be getting the Pfizer. You shouldn't go from Pfizer to Moderna and vice versa. Is that correct?
Correct.
And why is that, doctor?
Why is that? So I've heard various things, and I'd have to do, I think they're trying to boost the immune system. So they just want that's where the studies were done in a third dose. So that I don't believe the studies, there are studies, ongoing trials of switching them, because I've heard different things about that. But I think the research that they're basing the recommendations on, that the FDA approved last week, was research done on the third dose being the same as the prior doses.
I gotcha. Sorry, guys. I almost had a technical difficulty there. Being in Zoom. Thank you for the clarification on that. I know sometimes it can be a little confusing on what we should do. So I have looks like this one's a little bit more in depth. So let's see, Dr. Oken, let's see if we can take this one. Spike proteins, this is from Lee, are in each of these vaccinations correct? There have been lab studies adding the same spike proteins from COVID-19 to a null cell, and lab animals have had blood clots and other issues. For an example, the more shots you get, the more bad it is for you. What are your thoughts? I went kicking and screaming to get my first Moderna shot, and the second one will be at the end of the month.
So the vaccines that we're getting presently do not contain protein that resembles the spike protein. It contains instructions for us, for our bodies to make a protein that resembles the spike protein. And then our body actually creates antibodies to the spike protein that we've actually exposed to our body. And that antibody is a neutralizing antibody. But there's other things at work once we actually get immunized. We make neutralizing antibodies, which we hope will then attack an incoming virus and keep it from attaching to our cells to allow that virus to replicate on our cells and cause illness. But we have 3 other mechanisms that help us with defending ourselves. One's called the memory B cells, which are invoked they're on patrol once we've been vaccinated, that if they get wind of the infection coming in, they start making spike protein after we've been vaccinated. And then we also have what are called T cells. They're CD8 cells and CD4 cells, or killer and helper cells. And they actually also get affected by our vaccine. So when we measure for immunity, we measure for the neutralizing antibody that we've created, but we actually get more than that. However, we can't really measure that just yet.
Thank you. Lee, I hope that has answered your question. We are getting a lot of booster shot questions, so I'm going to kind of scroll and get those answered. Let's see. Sorry. Well, let me move to this one. What information is available about the chances of a variant making the current vaccine options ineffective? Are the boosters in progress for future variants, or do we have to wait for their arrival before we would work on another vaccine? That question is from Sean. Dr. Rossman, you want to take that?
Sure. I just want to give a shout out to Lee for being so courageous in getting that first shot. You've been very thoughtful about it and waited a long time. So kudos to you. So now back to, I think the question really gets to, should I wait for there's a better vaccine, maybe against the Delta? I don't want to make an assumption, but maybe that's what you're asking. There are ongoing trials all the time, all over the world, of scientists, incredibly smart scientists using great medicine and other methods to figure out the best vaccine for us. I would say at this point, as of today, the best vaccines out there are the ones that are authorized and that are being recommended. And in 2 months, 6 months, whatever, there may be different vaccines available to boost us. But right, that's been the past crazy 18 months, right? This is all new, and that's part of the roller coaster that Dr. Oken and I mentioned of, you know, we get information, and Anika, you mentioned that too. We get information, and then it may change tomorrow. And that's science, right? And as a scientist, that's the great thing about science. Plan, do, study, act. That what we know today is what we know today, and we're relying on new information as it comes out tomorrow to give you the best information tomorrow. So what I can say right now, there are trials going on for vaccines against the Delta variant and probably other variants out there. Dr. Oken mentioned that there's variants of interest and variants of concern. But right now, this is the best we got, and I'm going with the best we got.
We'll take that. Dr. Oken, I have a question. This is coming from Facebook. Opal is wondering whether it's safe to go to pools, outdoor concerts, and fishing piers in our community. And I can say myself that that's a question, going to pools and being out among people. Are those things safe for us to do?
So I think you have to weigh the probability for anything you do, but I definitely favor anything you can do outside is a great thing. Because when you're outside, you're really minimizing your likelihood of aerosol spread. Now, if you're packed outside, let's say you're at a concert outside and you're packed together, not so good, but you're still outside. And I think most of the folks who are worried about this hopefully have already been vaccinated. So they have that layer of protection already. So going to an outdoor concert, keeping your distance, smart. If you have concerns or worries, wear your face mask. Anytime you pack people closely, though, you're increasing your risk. Going to a fishing pier sounds great to me. Being outside at the swimming pool sounds great to me. Keep your distance, and hopefully you're vaccinated, so you're that much more protected.
Great. Good news for my daughter who loves to swim. So there you go. Question, my mother is 92 years old, vaccinated and living in my HOCO home. When will Howard County provide booster shots for seniors? Dr. Rossman?
I'll take that. So a week ago, or a few days ago actually, the FDA and CDC authorized vaccine, a third shot for immunocompromised, and it's very specific conditions. Persons with certain solid and blood cancers, persons with untreated HIV, persons with primary immunodeficiencies, persons taking medications that renders them immunocompromised. So that doesn't include people just by age. However, today, you know, I guess you all listen to NPR and the New York Times or the Sun or wherever we get our information from, is that the Biden administration is trying to fast track recommendations for boosters for everyone. So more to come on that. I know as much as you know. When that happens, you know, go to our website. We use social media. We use regular media as well to make sure that people have the best information they have to make the decision on whether or not, one, they're eligible, two, where they can go if they are interested in an additional shot. But I expect that will come probably within the next 4 to 8 weeks.
And we also have an additional question in reference to the boosters. Do we know how many will be available, being that the Biden administration has announced that it will be for everyone? This question was from Jim.
Jim, that's a terrific question, because I think we all have PTSD from a year ago when we had the priority groups and registration and not enough vaccine. Right now, I can tell you in our freezers and refrigerators, we have thousands of doses. some of which will expire before we're able to use them, which makes us really sad. But that's where we are right now. I expect that we would be receiving additional doses to be able to cover everyone. If you listen carefully to the news, they were careful, I think, to curate the message saying that persons would be eligible 8 months. It's kind of an interesting number. 8 months after their original dose. So we began vaccinating, if I remember correctly, it was Christmas Eve when Howard County began vaccinating. It was initially first responders, healthcare providers, nursing homes. So I think if we follow the 8 months, there should be sufficient doses of vaccine to vaccinate everyone.
All right. Thank you, Dr. Rossman. Dr. Oken, I think this is one that I think we've all asked ourselves on more than one occasion. Stephanie asked, will COVID-19 ever die and go away, or will it keep mutating and returning as a different variant? We would prefer it to just die and go away, Dr. Oken. I just wanted to say that.
We sure would. But Stephanie, that's a great question. And it's a great biology question, because we know that viruses like coronavirus actually stay with us, but the herd immunity becomes so great that instead of being pandemic, it becomes endemic, meaning that it has reservoirs in our society and it's there and it can periodically affect vulnerable people. But I think we're stuck with coronavirus for the duration. And yes, we'll have to be continually doing great surveillance to make sure that a variant doesn't arise that we can't deal with. So we're stuck with it. But the more people that become immune or become able to defend themselves either through vaccination or natural immunity from having the vaccination, the stronger we become. And so I expect it to actually be down the road like influenza, which we see seasonally and is something that we have to do surveillance for and prepare for. And there may be, for many years to come, an annual coronavirus vaccination to keep our immunity up and keep the herd immunity up.
Can you just dive a little bit deeper, Dr. Oken? We've heard community transmission, herd immunity, all of these things. And I think sometimes some of us are using them interchangeably. Can you give just a little bit more information, especially on what herd immunity is and how I know vaccines are a part of how we achieve that, but could you just dive deep a little,
Sure.
dive a little deeper for us?
So we refer to herd immunity as a concept that means that there's a certain number of people in the herd that have immunity, so that when the herd has an introduction of a virus that could possibly infect it, the virus actually attacks everybody, but those that are protected actually don't get the virus or ward off the virus. So there's a very small vulnerable group that either gets vaccinated or gets the infection, and then everybody's immune. So then therefore the virus has nowhere to go but to die. So the greater the herd immunity, the less likely a virus can actually affect individuals in the herd. Community spread basically just refers to, you may remember when this started, we were talking about tracing. So in tracing, we figured out who had it, and then we worked backward to find out who else had it and where it came from. So that's very helpful in the beginning of an epidemic. But once this became pandemic, it was impossible to do tracing. And then we knew that the virus was being spread from one person to one person because it was in the community. Now we have this concept called the R0 concept. And this actually, different viruses have different degrees of being contagious. The wild variety, when COVID-19 started, for every person who got COVID-19, they could probably give it to 1.5 to 2.5 people. That was called an R, 1.5 to 2.5. As you clamp down on the amount of people that had it, and the virus actually started to, we held down the surge, the R0 value fell. Now, the Delta virus, because it's more transmissible, has an R naught value of between 3.5 and 4, meaning for every one person who got it, they could give it to 3.5 to 4 people. Ergo, that's why it's so much more transmissible. And that affects community spread. But remember, the more people that are vaccinated and the more people that have natural infection, the less spread. So as soon as we get that herd immunity up higher, we'll be much more likely to stop the surge and hold down the virus to levels of prevalence that are very low. You may remember that in June, we were doing so well. Our prevalence of positivity was less than 0.5%. And now, as of today, I think we're at 4.6%. In other words, 4.6% of all the specimens taken are testing positive for COVID-19. So once we see the prevalence fall down more, we see that knock down, we're in a good position. When prevalence is less than 1%, things really can relax. But this is dynamic. So when we see it going up, then we have to make dynamic changes too. Face masks, isolation, more vaccinations.
In other words, keeping our eye on the ball as it is a moving
All
target.
the time.
Yes. So I have two questions, and then we're gonna end with those. But one is asking to explain about the antibodies, the significance of having antibodies, and then possibly, I believe David asked, does it make sense to have the antibodies evaluated by blood testing prior to determining if a booster is needed? Dr. Rossman?
That it was a David. It was one. That's a very complex question. So I'll start, and then I'm going to hand it off to Dr. Oken. How about that? So one, we're learning what antibody tests in life mean, right? Dr. Oken mentioned when he described the incredible immune system and the immune response, I think that he was responding to a question about the spike proteins. And he mentioned neutralizing antibodies, T cells, all these humoral cells, all these different parts of the immune system that respond. So when someone does an antibody test, there's a variety of different antibody tests. So one, I would need to know, what antibody tests were they performing? And to be able to relate to what that may be meaning in terms of someone's overall protectedness, which is really what we're trying to get at here. And I'm going to say for me, I don't have enough information to really rely on what the antibody tests are saying in terms of what that means for an individual. Now, again, I'm in public health. There are factors related to the individual. So if you're an individual who's in cancer treatment and your provider does antibody tests against COVID, well, that putting a couple of things together may mean something to you, that likely that you're not as protected as somebody else who's not on the cancer treatment. But the point I'm trying to make is there's a variety of different tests. It's really important what is being tested. And then it's also important to understand that that test is not testing the whole immune system and response that we are learning is important in terms of the protection that vaccines provide to a person.
And Dr. Oken, if we have just a few minutes, or a couple minutes actually, if you wanted to
Yes.
to go ahead and add your thoughts to that
So
question.
clinically, we're in situations where we have patients who are very vulnerable. Renal transplant patients, patients who may have gotten the vaccine, but they're really unclear as to whether they got the effect of the vaccine. If you're healthy and have no other ongoing issues, you've gotten both vaccinations of the mRNA or the J&J1 vaccination, you can basically be reassured that you got immunity. Now, we do have immunity antibody tests that we are doing, and we're usually reserving them for special cases. So if we find someone, let's say a renal transplant patient, who did not get an antibody response, then currently we are giving them a booster, and we're hoping that that booster actually brings up their neutralizing antibody. But once you get the vaccine, there are more things that are going to give you an immunity than just the antibody, because of our wonderful immune system. The different diagnostic labs in the area do this test. It's a blood draw. We get results 1 or 2 days later, and it's helpful in decision making. But if you're a healthy person and you've gotten the vaccines, you don't really need to worry. You got the effect.
Perfect. Well, we know that we are not getting to everyone's questions. You know, what, that ball starts rolling downhill, they start really coming in. So we apologize that we've ran out of time, but I do want to give both of our doctors information to you all. You can reach Dr. Oken via email at harryokenmd@gmail. And you can keep up to speed with all of the things that are happening at the Howard County Health Department at www.howardcountymd.gov/health/COVID-19. And you can also email danica.rines@columbiaassociation.org to reach the CA Communications Department. I want to take a quick moment to turn this over to Dan Burns. As the Director of Sports and Fitness at CA, Dan has worked closely with Dr. Oken, the health department, and other experts throughout the pandemic to make those key decisions that many businesses have had to make, primarily when and how we open safely. He's also been monitoring a number of scientific studies that have connected a person's physical health to their ability to fight the virus. Hi, Dan. Thanks. Take it away.
Thank you. Thanks. First, let me thank Dr. Rossman and Dr. Oken for their valuable information tonight. As Dr. Rossman mentioned earlier, one of the best tools to fight this is information and having the right knowledge to move forward. And Dr. Oken has been a valuable partner through this whole pandemic for Columbia Association. We really appreciate that. And Anika, thank you for leading this conversation. It's again, incredibly important. I do want to change the subject a little bit and talk a little bit more about exercise as medicine, and being physically active. Even before the pandemic, in the United States, we were having a healthcare crisis, and we were all struggling with rising obesity rates among all age populations, heart disease, diabetes, all trending in a very bad way. And we know that physical activity and exercise is important for managing that, but it became more clear during the early days of the pandemic when we realized that those who were most vulnerable for suffering serious risk or serious symptoms of the virus were those who had heart disease, diabetes, obesity, among many other chronic illnesses. So being physically active is incredibly important. But now, as the pandemic wears on, we have kind of another problem sneaking in through the back door. We're having a tremendous mental health crisis. Kaiser Family Foundation just recently published a report. From January to June of 19, the average adult share reporting symptoms of anxiety disorder was 11%. In January of 21, it was 41%. For children 18 to 24 in December of 2020, it was 56.2%. And in a community like Columbia, it's so important that we look at all communities, and communities of color were hit even harder, with many communities reporting 46, 47, 49%. It's becoming a tremendous problem in all communities, but in ours as well. And what we can do with that is be physically active. We're so lucky in Columbia with all of the amenities we have, and in Howard County in general. It doesn't take a lot. In addition to reducing the risk of chronic disease, those who are physically active report they're happier, they experience greater levels of excitement, enthusiasm, they're more satisfied with life, have higher self-esteem. There's so many benefits just from being physically active. The average adult needs 150 minutes a week, 30 minutes, five days a week. The average child, 6 to 17, 60 minutes a day. So getting out and playing. All that means is Look at Anika's background, walk around that wonderful lake. We have 95 miles of pathways to walk. Go to the pools and swim, or mini golf, tennis, pickleball. If you don't want to take classes, but we have all the classes available too. We even have programs and services on our website at CA at Home, where you can take some recorded classes at home. But in all of this, in addition to getting the vaccine, being physically active, not only in the long term to preventing the chronic disease is important, but even now in the short term, as we see these rising rates of mental strain and mental illness, it's even more important now that we all keep that in mind and get out there and move.
That's a great message to end with, is your health is important regardless, and it will help us get through some of this as well. So I just want to thank Dan Burns, Dr. Oken, and Dr. Rossman. And I just think what an awesome opportunity that our community had to be able to just ask questions directly. So if you all need their contact information, please don't hesitate to contact us so that you can get more answers to your questions. The hope is that you're leaving today better, with a better understanding of how the virus is impacting our community. And we also hope that you are leaving with a sense of empowerment. Information can really make you powerful. Knowledge is always power. It's a great quote. You took the time to learn, and now you're better equipped to keep you, your loved one, and your community safe. Thank you again to the Columbia Association and the Howard County Health Department for engaging the community in this conversation. And again, this discussion will be posted on CA's YouTube page, so you can share this information with others or watch it back yourself. Maybe you missed it. Maybe you were in the process of getting someone dinner and you missed that first opening spot. That seems to be the story of my life often. So you'll be able to run it back and look for the answers to your questions. Again, my name is Anika Baty-Mills with Columbia Inspired Magazine. It has been my absolute pleasure to moderate this conversation with you. I hope you all have a wonderful rest of your week. Take care of yourselves and take care of each other.
Thank you so much. Take care. Yes, those are the words. Take care, right?
That's right.
Thank you.
Thank you.
Thank you.